Well, hi, my name is Rizwan Bukhari. I'm from Dallas, Texas, and I'm a vascular surgeon. The better question to ask is why aren't all vascular surgeons at a lifestyle medicine conference? But really, uh, you know, joking aside, a few years ago, my wife Maya and I got introduced to the whole food plant based lifestyle. And then subsequently, we learned about blue zone living and became very interested in these lifestyle concepts about how to live healthier and longer. And then subsequent to that, I got introduced to ACLM and the six pillars, and it resonated with me and living a healthier, longer lifestyle and preventing disease. And so I was hooked. Yeah. So after we became interested in ACLM, the next natural step for me was to get further involved, and I did want to become boarded. So I took the exam in 2019. I think at that time there were about 300 people sitting for the exam. And then in the last few years, especially through COVID, the membership has exploded, which is just amazing, and it's so fulfilling too to see the interest growing and growing. I've heard that there are, I think, 1,200 individuals sitting for the exam this December. The pillars of lifestyle medicine are very common sense lifestyle things that aren't necessarily what we consider traditional medical treatments. So when physicians and other healthcare individuals start to work with clients and patients, it is more of a coaching, and it's a teaching of lifestyle rather than what we consider traditional medical therapeutic interventions. So it is a different approach. It's more collaborative, and it puts the healthcare professional more on an even level with the patient rather than talking down to them and telling them what to do. So it is more of a coaching approach, in my opinion. So I incorporate lifestyle medicine in two ways in my life. Well, maybe three ways really. Number one is I incorporate it into my own personal life, applying the pillars of lifestyle medicine and continually trying to strive to be good at these pillars and being better at sometimes and better at some than others, but always trying to improve. So that's a personal approach. And then in my practice, since I've learned about these things, I always taught my patients what I call risk factor modification. But as I learned more about this, I became very much more specific in how I taught them. And so I've incorporated lifestyle changes into what I teach my patients in order to help them be healthier, improve their outcomes. But as a specialist, I don't get the opportunity to spend as much time with them as possible. So I also try to utilize the resources that are available to us: registered dietitians, health coaches, wellness coaches, telemedicine. So I try to refer them to many of my colleagues for more in-depth work. And then my wife and I, Maya, also have outreach to the community. It's grown beyond my practice because we're so passionate about this that not only do we want to just teach my patients, which is a limited subset of people, but we want to take this to as many people as we possibly can. Yeah, so as a part of our community outreach, which I'm wearing our shirt, Love and Balance, that's our website, loveandbalance.org, we try to engage in various opportunities for the community. We have a monthly walk with the doc. We've partnered with the national organization, and so we have a walk every month, which is nice and regular, and we have our regulars who come out and other people, and then we do potlucks from time to time. We do movie screenings. We invite guest speakers, and so through all of these various opportunities, we engage the community and try to get the word out. And I often say that we're just trying to plant seeds in the community over and over again, expose people to this better way of living in the hopes that people will learn more, become interested, and want to learn more. Well, what I'd like to say is that my exposure to and adopting lifestyle medicine has been transformative for me, both personally and professionally. And as a vascular surgeon, I do feel like I've done a lot of good for a lot of people. I'm intervening therapeutically on a disease, a chronic disease, at the backside of it. And what this has done is kind of reinvigorated my spirit as a healer, in the sense that I'm being given the opportunity to teach people and participate in a way to teach people how not to get sick, how not to get these chronic diseases. And that has made me feel better about what I do. And then the opportunity to, so personally, it's transformed my approach to life. I feel better about myself, my health, and my opportunities for living a longer, healthier life. But then I'm also able to try to give this to my patients as well and the community. Well, as I said earlier, our website is loveinbalance.org. So I encourage you to go to the website there and check us out. We have a lot of resources. And then my main social media is Instagram, and it's Dr. Riz, Dr. underscore Riz, RIZ underscore Bukhari.
All right.
Yeah, we'll see you in Orlando and hopefully more after that.